Hi guys, let's talk rehab. Did you or someone you know recently experience a stroke? Then this video is for you. Stroke is a life-threatening medical emergency. It happens when the blood flow to the brain is stopped due to a block or a leak in the blood vessels. Due to the recent advances in medical sciences, more and more people are surviving stroke. But surviving doesn't necessarily mean living a normal life. Depending on the area of the brain involved, there can be different devastating manifestations of stroke. If it affects the brain area that controls mobility, a patient can have paralysis. If it affects the brain area that controls speech and language, patients might not be able to talk. Similarly, a stroke patient can become dependent on a 24-hour caregiver and lots of tubes for feeding, breathing, and passing urine. To rehabilitate them from that situation to a level of independence that they are able to go back to their work, live a life of quality and dignity takes a lot of effort. When to start rehab after stroke? The current guidelines advise starting early rehabilitation as early as 24 hours after stroke when the patient is medically stable. What all exercises to be given? Is only physiotherapy enough? Ideally, the stroke rehabilitation has to be provided by a multidisciplinary rehabilitation team headed by a physiatrist. How much exercises to be given? Studies have shown that more than 3 hours of therapy per day will lead to better outcomes as compared to less than 3 hours of therapy. When should these exercises be given? The initial 3 to 6 months is when there is maximum potential for recovery. If you can get the adequate rehabilitation care in this initial period, then there will be best possible outcome. But many a times patients might not be able to access that kind of rehab care in the initial period. Then there can be different chronic complications of stroke like spasticity, contractures, pain, HO, fractures, bed sores, etc., which will have to be managed accordingly. In the coming days, I will be talking in detail about these chronic complications of stroke and how to manage them. So don't forget to follow for more rehab info.